the phone has become, in my mind, in my time in this industry, so much more well received than it was prior in our industry. So we have calls now recorded and everything basically compliant so that we can help those individuals. And truly, again, we can have a review done in 20 to 30 minutes.
They'll review their medications, their doctor network. They'll compare benefits. They're able to do that all over the phone.
All over the phone.
Welcome, everybody, to the Medicare Made Simple podcast with MediConnect. I'm Lance O'Brien, joined with
Lauren Uran.
And I cannot believe it is August already.
They always say the time flies when you're having fun, right? So
are we having fun yet? It's going to be a very, very chaotic year.
It is.
This year, but excited to get some great information out in this podcast about what people can begin to expect around the annual enrollment period. Because for us, for a lot of people, August is the end of summer, right? It's when, kids go back to school or people go back to college and all those type of things. But for you and I in the Medicare industry, this is the time where we're really ramping up for our super busy season.
It is go time. We are busy taking certifications, getting ourselves prepared and ready to go for this busy season. Every year, it feels like it comes earlier and earlier. And this year, I will tell you, we're doing more prep than we have in years past.
Yeah, it's been really, really crazy. And we're not going to be able to get into all the details of everything that's happening. Right. But we do want to talk a little bit today about what people should expect, right? This
Absolutely.
AP. So if we think about it, Lauren, a little bit, what's the one word or what's the general feeling around Medicare right now, you think, for the average person out there?
Confusion.
I think there's a lot of anxiety, a lot of fear. Like from my perspective, doing a lot of radio spots, talking to a lot of the different carriers, things of that nature, that I feel like I can't get into a conversation about this without people kind of pushing the panic button.
A little bit this year. Yes.
Yeah. And what I mean by that is like, we're not just pushing the anxiety button of, hey, it's another year. I got to pick more insurance. I hope it goes well. I hope I get the right plan. I mean, we're talking about pushing panic button. And what I mean by that is Medicare's not going to be here in 2 years, right? Medicare's going away. And like everybody's having this feeling that, the sky is falling, if you will. Is the sky falling? No.
It's not falling. And I've been doing this for about 15 years, and it's every couple of years. I almost feel like it's a pendulum, right? It goes back and forth. That anxiety and unrest happens. It's kind of like the political scheme, not to get political, but, things change every so many years. Kind of the same with Medicare. You kind of get that ramp up of people going, oh, it's going to go away. It's not going to be here. But we are still in the height of the end of the boomers and people turning 65 every single day. So not only is it not going away, the need has risen.
Yeah, I mean, the scope of the Medicare program to just have that end, I mean, you can't do that without some kind of a plausible solution. So I wanted to kind of address that first, right? Because the sky is not falling. That being said, it doesn't mean the sky might not be dark.
Might have a few storm clouds raging this year.
Exactly. There's going to be some storm clouds this year around Medicare related to some of the legislation, not just the big, beautiful bill that is getting a lot of conversation right now, but still fallout from the Inflation Reduction Act.
And I think what I was saying even about that pendulum idea, right? What I think a lot of people, the big beautiful bill comes out, everybody's focus is there, right? But you have to remember that there were other things in the past that were implemented that are still in effect. So again, it's kind of like this rotating change that's occurring, and there's always something new, but you have to remember what was enacted in the past and what's actually enforced now and where we're headed. And it gets very convoluted, just kind of like Medicare itself.
Yeah, it sure does. So, like, you can't say we're going to cap all insulin at $35. We're going to take and eliminate the donut hole, and we're going to cap what people can spend on their prescriptions to $2,000 in a year. And you can't make all these other changes that are really positive in a lot of ways and think that they're not going to have impact financially and things of that nature.
Right.
So we started seeing the drawback last year on some of the plan benefits, where really what we had seen the previous 6 or 7 years is I like to call the golden age of Medicare, right? You know, you've got benefit expansion and price compression. People are paying less for their coverage and they're getting more. I mean, who wouldn't want that? I mean, that's a great scenario. And last year was a little bit of a step back.
Right. And I think even when I started at MediConnect about 3.5 years ago, I was really excited because there was all this opportunity and all these, you know, wonderful benefits that were occurring, that you had really a lot of homes to put people into. And now, again, you're seeing this retraction, not even retraction, but again, you know, things are going to get a little bit pricier, right? And look at what's been happening in the world around us, not even just Medicare. Gas prices, home prices, it's going to follow in suit.
Yeah, so prices are going to go up this year. Again, exactly to what level, we don't have all the details on that. Benefits are going to also get a little bit more expensive, some copays. Some of the extra benefits might go down a little bit, right? And it's not just going to be the Medicare Advantage plans that are going to be affected. The standalone prescription drug plans are going to see probably increased premiums, increased deductibles. We already know right now, anybody that's listening today that has a supplement, like one of those letter plans, Plan F or Plan G, Plan N, that their prices are going up at higher. So there's a lot of change coming. There are some storm clouds gathering, though the sky is not falling. So, Lauren, how do people need to prepare for this, or what should they expect and when?
So that is a great question, Lance. And I think a lot of people, you know, that are on Medicare plans need to know that there is something that comes out every September. Whether you are on a prescription drug standalone plan with your Medigap, your lettered plan, or a Medicare Advantage plan, there is something called the ANOC, the Annual Notice of Change. Okay, and that is slated to be in homes in the month of September. Could vary carrier to carrier, you know, by a few days, but that will be a brief summary of the changes to your specific plan. So remember,
let's say that again, because I actually think that's one of the most important points of this point. What changes are they getting in the mail?
To their specific plan, the plan that you are actively enrolled onto.
So they're getting a very specific look on how their plan is going to change. How many plans are there generally in counties? I know it can vary from county to county, but just a general number.
We're close to 90 in Allegheny County for the Medicare Advantage plans, and then prescription drug plans, again, you know, approaching 15 there. So yes.
So their plan is changing, right? It's going to tell them what is changing for the better, what could be changing for the worse, if you will, right? You know, meaning a copay goes up or something is retracted from the benefit
drug
package.
deductible goes up, right?
Exactly. But it's not telling them what's happening across the macro scope,
It is
the large landscape of Medicare. And what I found funny is you said that that's going to get into their home sometime in September.
Correct.
It used to be that came more towards the end of September. Last year, we saw some of them getting in there like early September, right?
Right.
Why was that?
You know, again, there were a lot of changes. So it was to prepare people for the incoming change. You know, I think a great point that you made about last year was the drug deductible. So there was always the ability to have a drug deductible, but with the cap on prescription drugs, a lot of plans, especially Advantage plans that we never saw enforce that deductible, did take advantage of enforcing that, because again, their spend was going to be also heightened from this cap being added to all of the plans. So they got that out because they knew there were going to be big changes. There were the big changes to just the way the prescription drug plans worked in regards to the donut hole being removed and that cap being lowered.
Yeah, I mean, I think that's a really good point. It's not like the Medicare Advantage plans never charged the deductible or they weren't allowed to charge the deductible.
Correct.
The deductible was always there.
They didn't need to.
There was a Part D deductible that they could be charging, but they didn't need to.
They had the donut hole. So again, when folks had more expensive medications, they were on the hook for less. Now that that cap was put at $2,000, they were on the hook for more money spent, and that's where they enacted it. So again, they've always had the ability to, but that was a big change that we saw last year. So I think, again, a lot of those kind of hit homes a little bit earlier because of the amount of changes that were going to be going on.
Yeah, I mean, prescriptions are definitely going to continue to be a big story. But changes in premiums and medical benefits are definitely going to be a big story. I think networks are going to be a big issue this year. You know, can you see the doctors that you want to see? And, you know, one of the reasons why we do this podcast, because I ask myself the question, like, for somebody watching this, someone that's reached out to us for our services, how can we help? And for me, it's I want to talk from a general sense. We just believe so much in education, right? Like, knowledge is power. I know it's an old slogan, it's an old saying, but like, we are so dialed in with the carriers, with the industry, with what is happening. Our number one focus is to get that information out to the public, right? So that's why we started our radio show 7 years ago, when there was kind of a heavyweight fight. I used to call it the sandbox fight, right? You know, it was a sandbox fight between, you know, a couple of pretty well-known names here about, could you use this health system and that health system? And we got on the radio and started talking about it because people didn't know. They were like, I don't know if I have to change my plan. I don't know if this is going to affect me. And we've just continued to really build out that education through our seminars, our webinars, the radio shows, the weekly radio spots that we do, these podcasts, right?
And it breaks down to our one-on-one appointments. Everybody, I think this is one of the biggest keys to picking your plan and being on Medicare, is you all have a different scenario. Our health is not the same, Lance, right? You have different needs than I do. You see different doctors than I do. We take different medications, right? Same for every single individual that we interact with. So if we can't educate those folks on what's available and help them make an educated, informed decision. You know, again, I've been in this industry about 15 years, and I've seen situations where, you know, people representing plans won't represent all, or won't represent certain types of plans. And that does a disservice to the client if they really need that, if that person is not educated. So we value that education for us as a team, and making sure that we have our certifications done and we're trained and we're in the know, so that we can turn around and educate those folks. And it's the biggest piece to everything. And that's what we like to take a walk with our clients down that education path.
Yeah. And I think that's why we're such a great resource. To your point, they get the ANOC. It talks about their plan. They call the company that they have their plan with, and they're like, well, I see my plan's changing a lot. I really want to look at other options. That company's only going to show them the options that are available in their actual portfolio of plans, right? So they're going to, you know, call company X. They're only going to see company X's opportunities, where with us, we're going to be able to talk about all the options that are available. So Lauren, I know you have a new role with us here.
I do.
Director of our client experience department. You're really working with our current client base, really making sure that they're taken care of. If someone calls MediConnect this year, which we know that we're expecting tens of thousands of phone calls, honestly, this year, but when someone calls us and they're currently a client, what should they expect?
They're going to come to my team. So our team in-house, all of our client service representatives are licensed, and we are able to help you review those options. So you're going to have a dedicated team for our clients. This is not our sales team. This is not for new business. So our 100% focus is with our clients, walking through that appointment over the phone, making it as easy as possible. And again, when it comes to, you know, let's say you're happy with your Medigap plan, for example, and you just need to review that drug plan, that can be done really truly in a few minutes over the phone. And the amount of, we were talking a little bit earlier about anxiety, the anxiety and relief that you're going to feel from just being able to handle that in a few moments with our dedicated team is going to outweigh, you know, any of that research that you have to go out there and do.
Yeah. And I think for somebody that's currently our client, I know for myself, I won't speak for anybody else today, but I like going to the same doctor, right? I like going to the same mechanic. I usually go to the same grocery store, right? I go to the same places consistently, and there's a reason for that. Because I've built trust. I've got to see what value is going to come out of that. And I think for a lot of people, when they're making decisions around their health care, finding a trusted resource is so important. And that's what our clients have. So we're going to get a ton of calls from our own clients. What about somebody who they're listening today, they scrolled across this, they went to our YouTube, found us on Facebook, and they're not currently a client. Maybe they've done this on their own all the time, or they've called a carrier directly. Maybe they've worked with a broker, but that broker hasn't been super responsive to them. What about someone new? If they reach out to MediConnect, what can they expect? What's their process going to be like?
Absolutely. So we do have our sales team, where I kind of came from before, and we have people that can help you over the phone. We have the ability to help you over the phone.
Talk about that. Build that out a little bit.
Yeah, absolutely. The phone has become, in my mind, in my time in this industry, so much more well received than it was prior in our industry. So we have calls now recorded and everything basically compliant so that we can help those individuals. And truly, again, we can have a review done in 20 to 30 minutes.
They'll review their medications, their doctor network. Correct. They'll compare benefits. They're able to do that all over the phone.
All over the phone. Even our representatives that operate in the field, so let's say, you've worked with one of our field reps in the past, they still have the same functionality and ability where they can take applications over the phone as well. So let's say even, again, you meet with somebody and you want a day or two to think about it. Do they have to come all the way back to your house if it's one of our field reps? No, they can quickly take that over the phone, so you don't have to be inconvenienced a second time as well.
Right. And if they want to be seen face to face,
we have that ability as well. So our field team, we can schedule an in-home appointment, and they will come to the home, sit down face to face, get to know that representative. And one of the great things is, if you're a new client, guess what? If you enroll with us, you still get to interact with our client experience division afterwards. So we're going to send you out a welcome call or text, and we're going to be there for you in the years in the future. I
also think this is a big point too, right? Because if I buy a car, which honestly, I don't like the car buying experience. I don't know if anybody likes the car buying experience, right? I go there, everybody starts coming out to talk to me. Can I help you? And I've been on the lot for 3 seconds, right? Give me a little bit of time to look around and see if there's anything here that interests me. But I go through that whole process. I work with that car salesman. I get my car. When I have a problem with my car, I don't call my car salesman. Who do I call?
Your mechanic.
I call the mechanic. I call a service team, right? And I get help from someone. And I think that's so important about how we do it here is we have a bunch of people that they do go out, they write business, right? But we also have the people that are there to support with billing, all of those other aspects.
Absolutely. We help with anything that pops up. Again, I always joke about I recently moved, and when I had to call to change my television services, cable, all that, it was tough. You know what I mean? And they didn't know me. And it's, again, it's a one-stop shop, but when you get those bills, insurance is not something that is going to always go smoothly, right? Yep. You have doctor's offices putting in codes, maybe a code is typoed, the insurance company has a problem reading that. So we're here for you when that happens as well. We help people, hey, I got a bill in the mail, I don't understand, why did I receive this? All the way up to, hey, what was my specialist copay again? What was my premium? Any question is not too large or too small for us to help with. And I think, you were talking about this analogy a little bit earlier, but it made me think of the grocery store. And our lives during annual enrollment period, I know about you, right? So we get really busy, and it's hard to be able to get to those things. And if I went to a grocery store that I wasn't familiar with in the middle of annual enrollment period to accomplish something, I would be so lost and so confused. So again, I think connecting with that familiar person and we have your information, so we know your history. You've been with us. That familiarity is going to help make it a more simple process.
Yeah, so it's not October 1st yet. We can't start talking about benefits. You're probably not thinking about your Medicare plan right now, but I guarantee you that we are. We are thinking about what is going to happen, as we talked about in this episode of Medicare Made Simple. The sky is not falling, but there are clouds gathering. Let us help you shelter yourself from the storms that are coming this enrollment period to give you the peace of mind that you want, that you need around your health care. If you have questions, you can reach out to us. Give us a call at 888 818-6334. If you want to learn more about us, want to schedule an appointment through our website, you can go to MediConnectInsurance.com. We're really looking forward to serving you this year and making sure that you can enjoy your retirement and not feel like the sky is falling. Thanks, Lauren.
Thank you, Lance.